Hi, this is Dr. Steven Sears, and welcome back to another episode of Heal the Burn. In healthcare, we're taught to sacrifice. We're taught to stay late, work when we're sick, attend those 7 a.m. meetings, even after long days and family obligations. We always put the patient first. But along the way, this becomes an idea that if we ever needed to step back or cut down, even change the shape of our career, that we've somehow failed. But what if that actually isn't true? Sustainability in medicine shouldn't be about enduring more and more until there's nothing left of you. Is it possible to build a career that allows you professional success while remaining a whole and authentic person? Today, I'm lucky to have with me Dr. Carrie Hersh. She's a neurologist and a multiple sclerosis specialist at Cleveland Clinic in Las Vegas. Carrie is deeply involved in physician wellness, leadership, and professional engagement work. She's spoken nationally on burnout and is deeply involved in mentoring and engagement initiatives. But her interest in this didn't come from theory. It came from her own experience with burnout. And what has emerged wasn't a story about leaving medicine. It was a story about redesigning it, about buying back time and learning to empower vulnerability as bravery. It's about the idea that being a great doctor and being a sustainable human don't actually have to be opposites. Carrie, I'm so glad you're with me here today. Welcome to Heal the Burn.
Thanks so much, Steve. This is such an honor, and I'm excited about our conversation coming up.
So to begin with, a little bit more about you. How did you become interested to pursue a career in medicine?
So there's not one moment that I can remember where I remember just thinking to myself, yes, this is it. I want to be a doctor. I feel like similar to your other guests that I feel like I've always wanted to be a doctor. There's never like this one moment in time that I can refer back to. But I will say that my father is a clinical psychologist, and I remember I remember him working directly with our patients actually in our house. So before he had his own office,
Oh,
he
wow.
used a small den in our house in order to see, and he never referred to them as patients, he referred to them as clients. And my mother has told me that when I was 3 or 4 years old, I would open the door to the client coming in to see my dad, and I would welcome them and offer them a drink, and apparently it was the funniest and cutest thing ever, and I don't really have a memory of this. It's a little too early in my childhood for me to have formed my own memories, but the way that my mother tells me this, it sounded very endearing, and it was really, I think, stepping from that place and then following my dad's career as I got older as a child and seeing how much fulfillment he got from treating people. And of course, in a different way than physicians may see their own patients. But
Mhm.
it was really the satisfaction, the joy that his clients got from my dad's care that I really think started to introduce the foundation of this is really meaningful work and I want to be part of that. And then it was really when I was moving, through elementary school, middle school, and in high school that it really started to solidify. I will admit that there was a brief moment in time in high school when I actually considered, well, maybe medicine's not for me. Maybe I should do law because my favorite subjects in high school were English, literature, and history,
Yeah.
not biology and chemistry. But I think that it was going back to what I wanted my life to be and how I wanted to shape what I do. And really in the spirit of helping and healing others that the enthusiasm around medicine came back. And so it was when I entered college, when I started taking all of my pre-med classes, that it really started to instill again that deep longing to heal as my profession.
At what point in your training did you sort of come to the idea of neurology.
Mm. Yeah, so that's interesting. So I went to the University of Florida, go Gators, for undergrad, and it was a little bit of not like a straight and arrow path. It was a little swervy. So I started my undergrad career with a major in microbiology and cell science, which is the typical major at University of Florida for pre-med kids.
Mm,
And then I actually started doing a psychology double major, just because I was so interested in it from my experience with my father.
mhm.
And I loved it. It was so fascinating. But I remember, after about a year or so of taking psychology classes, that I felt that I wanted something a little bit more tangible. And so then my interest started merging into neuroscience. And we were very fortunate at UF where there is this other major called interdisciplinary studies, with certain focus in an area of undergraduate studies. And this includes finding a research mentor, doing a research project, completing that research project, and then defending a thesis later on as a senior. And so I ended up doing eventually a double major in interdisciplinary sciences with a focus in neurobiology.
Oh.
And so that's really where it started. And my research project when I was an undergrad was in a lab rat looking at stress responses across different scenarios for different rats. And
Mhm.
then I actually did micro neurosurgery on these rats in order to um, evaluate the different neuroanatomical areas in order to better evaluate the stress response. So I guess I was an amateur neurosurgeon as a 21-year-old. Um, Funny that I never went into neurosurgery, but I guess that wasn't the end all be all of my interests and where I really wanted to go. But that was really where the neurology interests came in. And I remember entering med school saying to myself, I'm here to become a neurologist. And other than maybe considering cardiology for like a hot second when we were on the cardiovascular system, there it stayed. Really didn't fluctuate very much during my med school training.
Wow. Have you always been laser focused on things like MS?
No, that came later. So, being very fortunate to train at the Cleveland Clinic in Cleveland, I was exposed to basically every type of subspecialty in neurology in existence. And it wasn't until my rotation at the Mellon Center for MS Treatment and Research when I was in my, I want to say I did that subspecialty rotation in my second year of neurology training, where I just fell in love with the entire field.
Mm,
Um, I always knew that I wanted to be in a field that focused in on more chronic neurological care because I really enjoy establishing relationships with people and then watching them grow and really being able to see the fruits of my labor, so to speak. Not the treating and streeting, but really having a long term impact on their overall life, their livelihoods, their families. And so that did narrow things a little bit in
mhm.
terms of where I wanted to focus my time specifically in neurology. And it was that rotation at the Mellon Center where I was like, this is where I was meant to be. I get
Wow.
to do that chronic longitudinal care. I get to watch my patients grow into all of these exciting milestones. I get to celebrate wins with them. And I also do have a lot of interest in women's health and working with women. And in MS, the prevalence of women living with MS and related neuroimmunological disorders is 3 to 1.
Mm,
And so that would fulfill that piece.
mhm.
And then demyelinating disease to me is just a fascinating area of neurology. And I knew that I wanted to be able to not just see my patients longitudinally, but I also wanted to make sure that the care that I had truly had an impact. And at the time that I entered into my fellowship at the Mellon Center in 2013, there was an explosion of new disease modifying therapies that were coming out and continued to explode like throughout my fellowship training and early career, where we now have a profound impact on our patients' lives and their function and their ability to have wonderful quality of lives.
That's fantastic. I appreciate hearing that story, and it's interesting to although it's been a straight line, there's been different alterations along the way as you found ways to make it fit better, to what interests you. And I know you and I had talked. I actually have 2 siblings with MS, so I have a unfortunate, familiarity. Think back to early in your career. Do you remember thinking what being a serious doctor meant?
It's funny. During our training, we learn how to be doctors from the people we surround ourselves with, because really, where else are we going to learn medicine directly? And because I was able to train at such an incredible, now worldwide enterprise made up of incredibly smart and compassionate and really worldly physicians, it really set a very high bar in terms of what is considered a serious, excellent doctor.
Mhm,
And, being very type A, which, that's no surprise. Most of us physicians are very type A. I always wanted to achieve that bar and, in the best of circumstances, exceed that bar. And so when I was training, my idea behind what an excellent, serious, productive physician looks like is someone who is doing everything,
mhm.
seeing patients, being an educational leader, being an administrative leader, doing serious science and research and publishing, and doing national and international talks, and being invited to advisory boards and steering committees. It's a lot. For any one person, that's a lot. That's a lot to aspire to, and they're wonderful things. But I think that my early recognition of what is considered a serious physician, that certainly had an impact on me
Mhm,
and what I was expected to do
mhm.
in order to meet that bar or exceed that bar.
You have been pretty open about your professional burnout experience, and I had the opportunity to hear you talk about it, as a matter of fact. And I wonder if you could think back about when you were experiencing things not fitting right, and what allowed you to realize that something wasn't right?
So that's a big question. And in hindsight, I checked all the marks for burnout. But at the time, I didn't recognize what this was. So this was in June of 2019, so almost 7 years ago. I was still early career. I started my attending faculty staff position here at the Cleveland Clinic, Lee Ruvo Center for Brain Health in Las Vegas in August 2015. So by and large, I was still very much considered early career. And because of everything I just mentioned,
Mhm,
and wanting to be the best possible, excellent, serious, productive physician I could be, um, I was trying to do everything all at once. And I wanted to be on that fast track. And part of it was looking at my peers and my colleagues, and maybe some of it was reasonable, healthy competition. Maybe some of it was unreasonable, folks who were, well beyond me in terms of their duration of being in medicine and where they were in their own careers and how long they have been in attending for. I mean, some of it was just plain ridiculous of the standard that I was holding to myself,
Yeah.
but that's what I did. And I was working full time. So at that point, I was seeing probably more than 30 patients a week. And in MS, one visit feels like five visits. There is a lot to go through. And these visits are a lot, or
Mhm.
they can be a lot. And
Mhm.
as wonderful as it is to see the folks who are doing well, there's also a lot of complex needs in managing people who are living with MS.
Mhm.
And so that did start to weigh in, especially not just the face to face care, which is honestly what I loved more, but it was the non face to face care and doing work out here in Las Vegas, where our healthcare systems are quite disjointed. We do have EMR, but our EMRs are not connected to other healthcare systems, and simply trying to provide that excellent care that the Cleveland Clinic, um, certainly raises the standard towards. Sometimes it just became very difficult trying to coordinate all of that care in a system that was very discordant. So, with that, along with me wanting to do research and publish and, do talks and join advisory boards, and I call it all the things, right?
Yeah.
Doing
Yeah.
all the things that folks consider to be recognized as fully productive and a serious doctor. There's just doing it all at once.
Right. Yeah.
And looking back, I don't think that I was getting the mentorship that I likely needed. I certainly wasn't getting coaching. I did have a therapist I spoke with, but very infrequently. And I think I was just trying to do it alone, trying to prove a point, trying to prove something. That in hindsight was definitely a one-way ticket to burnout.
Would you mind sharing, like, some of the things that you recognized about yourself, what was happening, what gave you the impression that things were not all that you had hoped now that you had sought this huge, place in your career?
Yeah, it was the day that it's kind of like my reckoning day. It was the day that I decided that I needed to take some time out.
Mm.
So I remember driving to work one day, and I had a busy clinic schedule ahead of myself. And I remember driving to work, and at baseline, I do struggle with anxiety. And usually my anxiety is more like on a mild smoldering level. And, when I have that anxiety, I get it in my belly.
Mhm.
But this anxiety was in my chest. And I found myself needing to take more deep breaths while I was driving into work. I was struggling to feel like I was taking a full breath. I was like, huh, that's not like me.
Mhm.
Okay, well, tried, doing some deep breathing, and I think temporarily it helped. And I got into work and parked and went up to my workstation, and I opened up my first patient's chart of the day and started, just kind of doing some pre work and getting myself prepared to walk in when all of a sudden the entire screen went blurry and being it's kind of funny, but, being an MS doctor, we talk
Right.
about optic neuritis
Of
all the time,
course.
which
Yes.
is, sudden onset of blurred vision that progressively worsens over time. And in my head, I'm like, oh no, is this optic neuritis? Do I have MS now?
Yeah.
Which, in hindsight is ridiculous. But at the same time, I was nearly hyperventilating, feeling very anxious.
Mhm.
And in that moment, I stood up. I walked up to my medical director's office, um, knocked on the door. He invited me in, and I basically said, "There's something wrong. I can't see patients today. Something's happening." I was very fortunate that my medical director was so incredibly supportive, but not supportive in a superficial way. He was supportive in a very deep way. He listened to what was going on and told me in so many words that you are so incredibly valuable to us, your patients, what you do here, and you're going to do whatever you need to do to take care of yourself. And so we decided collectively that I was not going to see patients for the rest of the day, which is probably a good idea.
Yeah.
And so after speaking with him a little bit, I got in my car. I got right on the phone with my therapist, and we kind of had like a little crisis intervention session as I drove home. And then, of course, I collectively got on the phone with many different people who I consider part of my board of trustees, my own personal board of trustees. So my
Hmm.
husband, of course, my dad, who's a psychologist, and then some very close friends of mine who also work at the Mellon Center.
Mm.
The end all be all was that I ended up taking a 6-week medical leave where I did not go back to work. And during that time, I've mentioned this before, in other talks that I've done, other speeches that I've done, is that I've gone through all of this training, and yet this was probably the most work that I ever did, regardless of all of that time with education, higher education, medical school training, residency, fellowship. This was probably the most work that I ever did to have a better understanding of what happened, um, try to clarify to myself what's going on, where do I want to be, and is medicine really the right choice for me?
And you had mentioned that you actually considered leaving medicine at this point, right?
I did. So there were a couple of weeks in this 6-week medical leave where I was seriously considering what were some options that didn't directly involved patient care. And so I thought about consulting work. I thought about potentially going into the pharmaceutical industry. And part of this was because at the time I was, and I continue to do a lot of clinical research, my own research around different therapies in MS. And so because I was very active in research, I thought about, well, maybe I should look into, becoming a medical director as part of industry, and I think some coaching work too. Um, but with time and journaling and a lot of talking and therapy and coaching, uh, ultimately I found that it wasn't the being the doctor that was causing all of this, and
Mhm.
it wasn't practicing medicine that was leading to my burnout. It was the amount that I was trying to do all at once, having no boundaries, saying yes to everything. Um, those I think were the primary things that led to me feeling burned out. And honestly, I didn't really recognize that this was burnout until that day, and maybe even a few days later after I was speaking with a few different people who actually recognized it before I did. And I think that with time, I was able to more fully invest into that introspection and really figure out what at least some of the underlying issues were, that led me to feel comfortable coming back to work.
So you mentioned a lot of things like counseling, like mentoring, journaling, talking to the people you love, and what a great term the would you say board of directors? I think that's really that's a neat way to think about a group of people who really are there for you and you can count on them if you need to. Did you take any other particular countermeasures before you went back to work? Specifically about how much you were working or what you would say no to or anything like that?
So when I went back to work, I went back to work at 70% FTE, and I have never gone back. This time that I bought out for myself was very well intentioned. And I will say, because some of this does create a little bit of controversy about, oh, okay, so you're a doctor saying that the solution is just to work less. And, we have a doctor shortage already, and, we need doctors seeing patients. But for me, the way that I rationalized it was that I was buying time out so I could invest in things that really gave me joy and enhance the fulfillment I got out of my work that went outside of direct patient care. And while I still see patients during the week, this is a schedule that I feel allows me to be a better doctor because I feel more present. I feel less anxiety and less stress compared to where I was before, where I was trying to do too much. And when I'm in the room with the patient, I'm there in the room with the patient. I wasn't able to do that before because I was constantly worrying about how, honestly, I was worried about, okay, so I have all these patients say that means I have to do all these charts. That I was equating patients to charts, and that felt very wrong to me. And so now I'm in a healthier place where my patients are not thought of as charts anymore. I think of them as people,
Hmm.
and they are coming to see me because they trust me and they feel the care that they get is excellent care. So that's part of what has afforded me to do what I do, and I'm very fortunate where it makes sense for my family financially. It makes sense for the Larivo Center out here. I have leadership who's very supportive of the fact that I work 70%. I've never been asked to go back to 100%. Um, and I do feel that that is the fortunate part of all of this, that I do have that autonomy, which also continues to lower the overall sense of the lack of control that can also feed into burnout symptoms.
I really love the notion of buying back time. Can you say a little bit more about what that means to you?
I feel like I'm buying into myself, which I find is important. We're taught that's patients first. We're here for the patients. But it took me a long time to recognize that if I'm not here for myself, then I cannot be there for anybody else. And that would be a very significant and important loss. And so buying back time for me allows me to buy for myself and do what's necessary for me in order to thrive in my career and be there for my patients. Um, so that's what buying back time for me looks like.
Thanks. Did this idea of not going back full time, did it challenge the narrative of being a serious doctor?
What's really funny about this whole concept is that the only narrative that matched was mine. No one, no one has ever come up to me since I went to 70% FTE and said, Carrie, I'm worried about you because you're not working full time anymore. And I'm worried about your productivity and how serious you are as a doctor. No one.
Hmm.
So, so when I look back on this, this whole concept, I'm like, was I just building this all in my head? And I'm going to take this from one of your previous guests, Dr. Andrea Saikon. Is this just a story that I was building in my own head with all these negative little voices telling me all the bad things that I was doing and all the things that I have to do in order to be a thriving, fully productive physician? And I think
Those,
the answer is yes.
yeah, very powerful. The
Yeah.
power of stories.
And to be honest with you, I'm more productive now than I was before,
Wow.
because I was able to buy back some time so um, I can do some other things without feeling guilty or without feeling overwhelmed. That goes outside of direct patient care and goes outside of Cleveland Clinic because I do a lot of work outside of Cleveland Clinic that I think is helping to advance the MS field. And that brings a lot of joy and meaning to the work that I do. And I think I shouldn't even say I think, I'm a fuller person because of that.
I really appreciate your vulnerability and letting us hear this
Yeah.
side of the story. I mean, it's so scary, I think, for any of us to admit that we might not have matched where we are with where we thought we were going to be, and that disconnect is potent. So you have talked a lot about having multiple sources of meaning in your life now, like research, leadership, mentoring, wellness work. Why do you think it matters to have all of those different facets of you?
I have a lot of different interests. I think the problem was before that I was doing too much too quickly in a small amount of time, and I wasn't setting boundaries around the things that I didn't have any interest in doing. And part of it, I will admit, might be coming from a place of privilege because now I'm certainly in the middle of my mid-career. My application for promotion to professor is, moving forward very quickly. And so I feel that, well, maybe this is privilege that I can say, well, I'm doing well from, by my standards, really firmed in by the goals that I have for myself. And then, is it fair for me to go back and look at my younger self and say, "Oh, you shouldn't have been doing all of those things," because doing the things allows us to get to where we want to go, at least in some part. But I will say that my feeling right now is being able to figure out what I want to do and what I don't want to do, and setting those boundaries not only with other people but also with myself, allows me to better separate out what is really purpose driven and what is minutia. And so the things that I have collected into my career and what I'm doing are because of the things that I enjoy doing. And so when it comes to research, my goal is to be able to provide evidence based information that allows us to take better care of our patients in the clinic. And a lot of that research is based on comparative effectiveness studies across disease modifying therapy approaches. And I like to build that real world evidence because it is so important for the care delivery on a day to day basis, which is really why we're doing all of this work in the first place. And so I get a lot of joy from that. So I continue to do that. The leadership that I have outside of the Cleveland Clinic, so I'm the incoming president of the Consortiums of Multiple Sclerosis Centers, which is the largest nonprofit multidisciplinary organization in North America, allows
Wow.
me to it allows me to have a direct impact on the trajectory of how we are supporting healthcare professionals who are doing such important work for the people we care about living with MS and related disorders. And it gives me a sense that I'm driving things beyond just the one person sitting in front of me. That if I help one healthcare professional, I'm helping hundreds of people.
Yeah, yeah. Wow.
And my interest in workforce well-being and elevating what that concept is really supporting at a very critical foundation the healthcare professional who is managing all of these people and doing all of the hard work, it's just fueled by my history and my experience and my story, and I feel like I'm paying it forward. This is my way to give back, and really thank the people who are there for me, and then me being able to be there for other individuals who need help as well. And so for me, I would say that that's probably one of the most fulfilling things that I have done recently, and I'm so excited about the prospects. And I will admit that I'm going to give a shout out to Dr. Andrea Saikon because I am an advanced peer coach through the Center for Coaching and Mentoring at Cleveland Clinic. That I learned a lot of these skill sets from her program, and I'm doing it on an individual coaching basis, and I'm also doing it outside of the Cleveland Clinic. And I really feel that it's impacting individuals in a fundamental way that I didn't have when I burned out all those years ago.
Did you find after you came back from your time off that you spent or developed any outside hobbies as well, things that are not medicine? Maybe you weren't tending before?
Yeah, so I've given myself more permission to step away from work. I think that before I felt guilty when I wasn't working, even on my time off, even during what we call pajama time when, we're talking about doing work outside of working hours and clinic hours.
Mhm.
I wasn't fulfilling my time with work, then I was being lazy.
Hmm.
And like, again, in hindsight, is like it's ridiculous. We're people, we're humans. We need to take care of ourselves. We need to be with our families and our friends. We need to be joyful outside of medicine. As important as my career is, it's not and should not be my life. And so now I've given myself more permission to, go out with my friends and take walks and read. I'm a huge reader and, just sit around and read a book and, indulge in things that before I felt guilty over and now I don't, which I think is a much healthier mindset for me to be in.
Are you reading anything good right now?
Um, I think so. I just started the book. It's called Dissection of a Murder, so we'll see. Um,
You
I
you've
have a lot of different interests in different books. Some of them are novels and fiction based, and some of them are nonfiction based. But yeah, this is a thriller that I picked up that sounds really exciting. There is a book that isn't a thriller. This is more contemporary fiction called Yesteryear, and for the life of me, I can't remember the author's name, but oh, such an impactful book to read about an individual living with these preconceived notions of how life should be and basically her undoing because of it. It was very interesting to read. Yeah.
so you have a perspective too on this because of your leadership roles, but do you think that in general, not necessarily specifically to where you're working, but in the industry, that leaders are unintentionally reinforcing unhealthy ideas about sacrifice and endurance in medicine?
Yes. The short answer is yes. It's funny because I put together a LinkedIn article, well, not an article, a LinkedIn post about a month ago around this, um, about the importance of um, burnout prevention. And I don't want to say finding. I don't think that that is an authentic term because it suggests that we're lost, but reigniting our joy and purpose in medicine and how there are certain healthcare systems and practice that erode that. Um, Always being asked to see more patients, um, increasing efficiency in the workspace in order to see more patients. And from a business side, I certainly understand that these these healthcare organizations are businesses. And even if they're nonprofit, we still need to pay for our service lines. But on the flip side of that, asking our physicians, our clinicians, our APPs to do more and more and more and pile on more and more and more is going to threaten the future of healthcare because the attrition rates are going to be staggering. I think where some things, and you have talked about this in some of your other podcasts with other guests about the benefits of generative AI in improving our care.
Hmm.
It's not just about the charting, which I will say is lovely, and it has cut down my charting time in half. But what it really does for me is it allows me to be in the room with the patient without having to keyboard. And I I don't know what medicine was like before the EMR. I think I'm a little young for that, but I've certainly, read a lot of books and I've spoken with, lots of physicians who are more mature than I
Yeah.
am. And the concept of being able to just sit in a room and listen and make medical decisions based on the information that the patients are telling us. Wow, that sounds incredible. That sounds so impactful. And yet, with the EMR, for me at least, it's just another stressor in the room. It's just another tool that I have to use that separates myself from the patient who's coming in to see me so I can make sure that I'm jotting down and I'm getting all the information into the computer because I can't process quickly what they're telling me and getting it down in the computer. And so that cognitive overload, it just becomes very anxiety provoking. So it allows me to be in the room with the patient and I'm less concerned about, what how much I'm actually typing into the computer because the generative AI system will get that in for me. So I feel that the compassion that I'm able to exude when I'm in the room with the patient is so much more
Hmm.
than I had previously. But the point that I'm trying to make is that as lovely and wonderful as it is, I hope that healthcare systems don't use generative AI as a tool to um, use the narrative. Okay, well, we're making systems more efficient. Now you get to see more patients. That shouldn't be the goal.
100%.
That should not
Um,
be the goal. The goal should be to provide more compassionate and present and empathetic care that will not just improve how we feel about the encounter, but it will magnificently improve and enhance the care that the patients feel that they're getting back and improve their overall perception of how that visit went and patient satisfaction scores and so on and so forth, which are very important healthcare metrics. But I hope that the end all be all is not, okay, we are making the workflow more efficient. Now you can see more patients to fill in that time.
yeah, I'm very nervous about that. When where I work, when they first started doing the AI scribe, we would fill out a survey every week, and one of the questions was, "Could you now see one more patient per half day?" And I just felt very empowered to say, "That's not the point." We're losing good people in this industry because we're asking them to do things that are beyond and not what feed them, and you're not gonna have the ability to squeeze any more out of people if they're not here to be squeezed. So, I think you said that very eloquently, and I wanna thank you for that.
Yes, absolutely. And, I have heard from leaders that they feel confused when physicians, clinicians, APPs are advocating for less time in clinic. And their thought is that, well, we go into healthcare to take care of people and to heal people. We should want to be in clinic and see patients. And my argument to that is that volume does not equal love and passion for the field. It's quality. And so I would counteract that argument that it's not about the sheer number of people we're seeing, it's the impact that we're having on the people we're seeing. It's the quality of the care that we are able to deliver because we have the time, the space, and the grace in order to provide that meaningful care.
And we're not burning out our workforce. Um, so if somebody out there is feeling trapped between being all in and walking away entirely, where do they start?
Self awareness. So I've given a lot of talks on emotional intelligence, and there are four parts of emotional intelligence. There's self awareness, self modulation or regulation, and then there's social awareness and social regulation. And in my opinion, the most important aspect of being considered an emotionally intelligent person, which I will say is not a soft skill, as some people like to say. This is a very hard skill that clinicians should aspire to in order to manage their patients in meaningful ways. Okay. That's a little bit of a sidebar. But going back to emotional intelligence, I do feel that self-awareness is the most important factor of emotional intelligence because if we don't recognize in ourselves our strengths, our opportunities for improvement, what triggers us, what drives us, what values we have, what motivates our behaviors, we really can't do the other things.
Hmm,
So I would say that the first part is being able to recognize what's going on. And I will say that 2019-year-old me did not really recognize it. I thought I was sick. I thought I had optic neuritis.
right, right.
But now in hindsight, I mean, it's just like so obvious, the emotional exhaustion and the cynicism and the depersonalization and the futility. I had all of those things and they were brewing for quite some time. I just didn't recognize it. But I would say that that would be the first place. And I would say the second part to that is, and you had mentioned this in your introduction to me, and I do thank you for that. Vulnerability is bravery. We should aspire to asking for help. That's what makes us professionally responsible people. And it is a tenet of being brave to know when you need help, to know when I need help. Keeping it bottled inside and just trying to like push past it is only going to continue to fuel that fire. So I would say trying to recognize a trusted source. So, we have mentioned our own board of governors, our own board of trustees. So, who is someone, in your circle, in your inner circle, who you consider to be a trusted party and have a conversation. And I personally find it helpful to speak with other people who, quote unquote, get it, who are in similar positions.
Mhm.
And you would be surprised what they tell you because a lot of people don't talk about this because it's still considered taboo. But once the sharing starts, it makes us feel less isolated, less alone. And I think that it can really help the person forge their path forward by knowing that they have a village behind them.
Mm, that's fantastic. Carrie, I want to thank you for, again, your vulnerability, your experience, your energy, and sharing this story um, about what you've been through and where it has led you. And I think it's been really really special for me to get to know you and see where you are. And I want to thank you for your time today.
Yes, thank you so much, Steve. This was a lot of fun and thank you so much for inviting me to be a part of your conversations.
What I'm left thinking about after this conversation with Carrie is the distinction she made between leaving medicine and redesigning medicine. When burned out, it isn't much of a jump to believe there are really only two choices. One is keep going exactly as we are, or two, walk away entirely. And for some people, walking away may be the right answer. But Carrie's story reminds us that there may be another possibility, that you could change the shape of work before deciding the work itself is impossible. Buying back time was not about caring less. It was not about being less serious, less committed, or less productive. For Carrie, it was about buying into herself so she could create enough space to be present again, to remember that patients are people and not just charts, and to reconnect with the parts of medicine that still gave her meaning. And that feels important because so many of us carry stories about what a real doctor does. A real doctor works full time. A real doctor says yes. A real doctor pushes through. A real doctor does not need space. But, maybe some of these stories are costing us more than we realize. Carrie said something else that stayed with me. Volume does not equal love for the field. The number of patients that we see is not the same thing as the quality of the care we give or the humanity we bring into the room. So maybe the question isn't only how much more can I do? Maybe the better question is, what would allow me to keep doing this well? And maybe buying back time in whatever form that takes isn't a retreat from medicine, but rather a way of choosing to stay. If this episode resonated for you, please share it with a colleague. This is Dr. Stephen Sears, and I want to thank you again for listening to another episode of Heal the Burn.